we average around 4 to 5, maybe 6 calls a day. And out of those calls, I probably will deal with at least 3 people that have got some sort of mental health issue, whether it's depression, whether they've been suicidal in the past, whether their maturity level is not, they're intellectually challenged. You name it. A lot of the lower income areas you find that. People that aren't working are depressed. I think that's a daily operation. Everywhere you go, every domestic you go to, there's probably some sort of mental health type issue there, whether they have disorders or whether just depression is a huge factor, anxiety. Having Travis with all of his disorders and the things that he's had to go through over the years of ridicule, somewhat bullying, because he's special needs and people don't have a clear understanding of it. You're with them 8 hours a day. You need to be knowledgeable on this stuff, because it's going to make or break how your day goes. Are you going to battle with them all day long, or are you going to learn how to deal with them all day long?
Do you worry that someday as an adult he could have an interaction with an officer somewhere else that could go bad?
Well, that's a big fear.
Yeah. What do you worry might happen?
Well, one of the things, Travis doesn't like to be touched.
Yeah.
That's one of his biggest issues. And which is amazing, because when he plays football, he's got touched and tackled and hit and everything. But it's on a different aspect. It's under his control. Okay, but when somebody's touching him and he doesn't have control over that, he doesn't deal very well with it. So he can have some high anxiety level. He might say a few things that when he gets stressed out, some of his tics might start coming out, his vocal tics might start coming out. Some of the things that he may say aren't going to be as nice as what an officer might, Yeah. And if this officer doesn't know that he's got Tourette syndrome, and he starts blurting out some pretty bad stuff, that officer's probably going to hook him up and arrest him for disorderly conduct and not give him much of a chance to say much. And as soon as that happens, Travis is going to have what we call a meltdown. He's just going to fall apart. He could even be so much as violent, because he's going to try to get to the safest place he can be, which is probably going to be home. And wherever he's at, obviously isn't going to be home, so I can see that being an issue. There's a lot more out there going on than just taking calls, arresting people, doing traffic stops. There's a lot more going on with the community that law enforcement needs to be definitely a partner in the community. I think that there's a lot of agencies that talk about community policing and the role of an officer in community policing, but I really think that that's gone by the wayside because of budgets. In order to do good community policing, you got to be out in the community doing community policing, and that means you got to be there talking to people. You got to go by people's homes, stop in, talk to them, get to know them, let them know that you're a good guy. And it's easy for us to do that here because we got a lot more time to do that, and that's what we do the majority of the time. Is we're patrolling around, we're looking for things, but at the same time when we see people, we're waving at them, we're stopping and saying hi, how's your day. Those little things, I think, make a huge difference in your community.